Scott in Detroit, or Pontiac, Michigan, I guess. You're on the air with Congressman Pocan.
Hey, good afternoon, Tom. I'm actually in Oxford, Michigan, and thank you for taking my call. Congressman Pocan, thank you for allowing me to talk to you. It's an honor. One of the things that I've been seeing lately on TV is a lot of ads from local unionized groups like the fire department claiming that single payer is bad, right? Medicare for all is going to be bad. Well, being that labor, that's their kind of their linchpin in negotiations. Is there anything going on in the House to help strengthen labor unions, but also give them more of a platform in things like a 32-hour work week or better wages and wage protections?
Other things than health care that they can offer as benefits to their employees, in other words.
Exactly.
Yeah. Congressman?
Right. Yeah. Great question, Scott. And there's a couple major initiatives. There's a bill that I do expect to pass this fall that would help unions in many ways around collective bargaining rights and strengthening our ability to have labor law work for workers, and that will pass the House of Representatives. There's also another bill that Bernie Sanders and I have introduced that goes even a little farther, that would go towards car check and a few other things that we think is important. So there certainly are provisions around that. I think my conversation I would have with any labor leader, and I'm a member of a union for 3 decades, and I work very closely with labor here. That's where my passions are, is that we can't, just because of the attacks on labor, one of the things that they have fought for well for people have been better wages and benefits. If everyone has health care, that allows you then to fight for other better benefits, whether it be retirement or pay. And we shouldn't lose focus on that. Everyone will have the boat lifted up if we have a universal healthcare system, a single-payer system, and they still have a very strong role in fighting for people's wages and working conditions against employers who all too often aren't living up to what they should. So unions can be strong, and everyone can have healthcare. That is not at all incompatible, and we need to pass more protections for unions to be able to give workers a voice in their workplace, and I think we can do both.